Today, in this video, you would learn what are the ethical issues you need to follow during the counseling session. It is very important to know the ethical issues when you are dealing with a client. In this video, you would learn what are the important things you need to keep in your mind when you're doing a counseling. Let's start. So the first way of making the clients to know what are their roles is very important during the session. You need to sometimes you need to take the signature. You need to take like a note from them that they are not involved in any the judicial jurisdictions while during the counseling or somewhat like that. Another thing is maintaining the confidentiality is very important because many counselors what they will do, they will disclose the information, and it is one of the against ethical system. If you really want to disclose information which may be important for the society, you can't tell the name of the person. You must not tell the name of the person. And disclosing information, it's some sort of it goes to crime also. But there is some exceptions also, because if the client is there is a threat of client's life, or there is some sort of a threat of state welfare, or there is a threat of some country's security issues, you can disclose information as per prescribed by the Indian law or the country's law system. Another ethical issue is like maintaining the boundaries. You know, counseling is a two-way process where you need to fix the boundaries between the client and the counselor. Sometimes the client and counselor gets into relationship after the counseling sessions, and it lasts for years, and the client sometimes is betrayed also. So for that reason, you need to set the boundaries also. You can't get into relation with the clients, which is unethical, which is unhealthy also. And most of the clients, they get some sort of problematic situation when they listen some good words from the counselor, when they think that the counselor is having good knowledge about himself or herself. They want to get into relationship, they want to get married or something. So that's why before the counseling we need to set some boundaries between the counselor and client to not to fall on this type of issues in future. And other thing is ability, profession, and updating your skills. If you're doing CBT, cognitive behavior therapy, and you don't know about a psychoanalytical therapies like a transference, content transference, and dream analysis, don't go with that things. Do the things which you know. You can't tell the client that I know everything. I can deal the things also, because you need to deal what you know, not the things you don't know. And many concepts what they do means, if the client having some schizophrenia symptoms or some symptoms which are related to clinical one, they do therapy, they do treatment for the clinical one also, which is unethical. So if the client mental being or client problems is not towards your jurisdictions or not towards your profession, please consult the client to other psychologists or other clinical psychologists or other psychiatrists who having more training or good training about other things also. And also, you need to maintain a good rapport, and you need to maintain a good empathy between your constant client. You can't go on treat like a parent, or you can't treat treat himself like a small one or something, because here you're showing empathy, not sympathy. And we are doing most of the counseling is done by the client center, not the counselor center. So here empathy plays a key role rather than sympathy. Okay. And you think, and you need to think in the client's perspective, not on your own perspective. Start thinking in the client perspective, automatically rapport is built, empathy is formed, and the client is free to tell everything about his problematic situation. Then you can control, and you can reduce, and you can coordinate his emotional instability. And also, many clients, many counselors, what they do means, there are some certain psychological counselors, they tell their personal problems also to the clients, which is not at all inappropriate. Because if you're suffering the same problem that client is suffering, don't disclose the same problem with the client. Don't tell your personal problems. So it will create some sort of disturbance, some sort of lack of confidence with the client. So never ever tell your personal problems, but you can tell that this was the situation I faced. but I got from it. You can tell that, but you can't tell that my wife also treating me like that only. What should I do? These wives are like that only. You can't pass generalized statements. So that's why I think so. Freud proposed a theory called counter transference for the counselors also, where where the counselors takes the emotions and all this nonsense from the client. To counter attack only, he proposed called counter transference, where the counselors are free to express his own views. So never ever take your personal problems to the clinical setup, which will spoil all the counseling session. And uh, you need to be like a it's like a counseling is like goal oriented or behavioral change oriented. It's not like a just giving a sweet candy words or something to the client. You need to focus on the action oriented. It's like doing, making, treating, and treating and relating, all these things. You need to show that action oriented rather than like only feeling oriented or thought oriented. You need to get into action oriented also, so that it can make a good results for the client, and as well also you can build a good fame in the society also. And last but not least, you need to there is certain uh, uh, like a licensing process which is proposed and which was formed by the RCI, Rehabilitation Council of India. When you want to become a clinical psychologist or counselor psychologist, you want to set up a clinic, you need to follow all these norms and rules which was set up by RCL. Without following the rules and regulations, if you're doing the counseling, it's not at all professional. It may like it may like it may uh, it may cause some sort of unethical issues. It may cause some criminal charges against you also. If a client thinks that he has suffered a lot from your counseling sessions, or in a wrong way, he has a right to file or petition on against you also, and he can cancel your RCI registration also, license registration also. So better be careful and explain everything to the client, what he is going to do, what are the therapeutic goals. Because if you're treating with a phobia, there are certain therapies which was proposed by Viristic, like flooding, like exposure therapy, where certain clients, they will get into some sort of trauma and they will file against you also. So be careful also. And there are certain clients who are having a criminal data or criminal history. You need to be careful with dealing with them, and you need to be precise about the things you are doing, and you need to take a permission from them that if the information is setting, or if information is setting the state, or if information is against the law, there is a chance of disclosing information. So all these things you need to keep in your mind to make the counseling clean and well, so that there is no litigation problems in further. I think you got some sort of idea about the ethical issues. If you have any doubts, you can comment in the comment section, and subscribe my channel, and have a good day. Bye.